when it was our renewal time, it was going to save us a significant amount of money to switch and have the exact same out of pocket, the same everything. And I'm like, that's a no-brainer. I'm switching over. I've had to use it for a couple of years, and it's great. We probably had Kaiser forever, so everybody was kind of used to the Kaiser
Yeah.
program and plan. And when we switched over, we thought, man, this might be a little bit of a problem, but we haven't had any kickback or any problems with
No
our
hitch in the
employees.
giddy up. Yeah.
No,
Well, see,
and
what
everybody's
I,
happy because I didn't have to go back and tell them, well, you're going to pay another, 100 a week out of your paycheck or whatever it was going to be to cover that, that year. That year when we were switching over, they were going to increase our premiums by a substantial amount. So by the time we did the math, I mean, it was something to the tune of 100 grand is what we were saving.
annually. Yeah.
That was the best part. And then, like I said, the coverage is exactly the same. There's no difference. And the providers are great. I've been to the doctor myself, lots of times I'm old, so I have to go to the doctor and get stuff
No,
done.
no, no, you're
Yeah,
not.
and I'm gonna go talk to the doctors over there and see if we're good to go. And I am just they've been better than doctors than the other guys that I used to see as far as knowing me and the care and the personal attention to things that I need to deal with. So the switch to me has been better in the long run.
So, like, you just kind of minimized what most people think is a massive deal,
Yeah.
right? Like
Right.
leaving a doctor that like, knows them really well. I mean, did you just say, "Well, it's what I got to do"? Was
Right.
that kind of the simple decision?
Yeah, that was a simple decision for me.
Yeah.
Exactly. I'm like, I got to do what I got to do. I mean, I got to save myself money. I got to save the company some money, and I got to save my employees money. That was the other thing. That's a big deal because they're paying, it depends
Their
on.
percentage. Yeah.
So I
Yeah.
jumped on board with it right away personally because I figured if I did it, then I could just tell everybody else how easy it was. And to be honest with you, it was a piece of cake.
Yeah.
And they're great doctors. They're 100% professional, and they've been really good to deal with. And so I've had a really positive experience with the whole thing, and my wife has also. So I
Like,
mean,
here's
I have no reason to say anything other than this has been a great move for us, because the doctor's situation is probably, if not equal, maybe even a little bit better. And it's more convenient and it's cheaper. I mean, so what's wrong with that?
why do you think most subcontractors will get the email or get a notification, or right now I'm sending out videos, like doing webinars with different state operations? Why do you think somebody would look at it and say, nah?
I don't know why they would look at it and say, nah, to be honest with you. That part I would not understand because to me, you're getting to be in a group. And, the biggest problem with being a single business owner is you don't have that manpower to go out
Small
and
pool.
get yeah,
Yeah.
I got, 50 employees or whatever that are on healthcare or less. And, you don't get any bargains out there. There's no wheeling and dealing. You get what you get.
Yeah.
So I figured if we could get in a group plan, because you
Mm,
always hear, if the group plans are out there and you can get involved in that they can save you money because you got all these other folks involved with it and it's a group plan. No different than working for a big corporation or whatever that gets the group deal, right? So I
yeah.
just figured that would be the better thing. I don't know why you wouldn't want to do that. It doesn't make any sense to me. Maybe they're used to their broker, their broker. And
Could be.
some of these brokers come out like as soon as you're going to switch, they're going to tell you why you shouldn't. They're going to, oh,
Right.
well, you're going to have a problem. This is going to be this, that's going to be that. I can personally tell you that I had some of that going on. People were saying, oh, you're going to have a problem. Well, we didn't have no problem. So
Right.
so just so you people out there that know that watch this video, you can testify from me that I didn't have no problems with it. It worked out just fine.